good to be back. I had my first 2-week vacation in 20 years. And this is MTP number 73. Now, this topic really, we could spend an hour on this topic, but I'm going to give you a quick overview of how we take care of this. There's a general diagnosis of anorgasmia, meaning you don't orgasm. We're not talking about ejaculate, we're talking about that orgasm. And I'm specifically speaking about males in this case, and even more specifically about guys who are complaining of this after they've had a penile implant. So I'm going to quickly go over, some of the causes, and then I'll go over the treatments. And this was a question from Randy back in October. Sorry, Randy, we've had just a lot of topics coming in, and I should have gone with this quicker. And I'm going to tell you the course that we take, the algorithm that we use when it comes to treatment, and a lot of people don't use that algorithm, but it's something that has worked very well for us. So when it comes to causes of this, you got to look at psychological components, and that's not my specialty. But I can tell you one thing I see is, you're watching too much porn, and then you go into the real arena, and then it becomes hard to ejaculate. And we see this in younger men these days. So this is not uncommon, and these are the psychological aspects are handled best by experts, sex therapists. You have to understand it's a reflex. So once that reflex is ignited, just kind of like when you hit your knee, that's when you're going to orgasm. And so if this component is out, you're never going to make it. If you're a diabetic, these peripheral neuropathies, they can affect that reflex. And then there's certain things that we can do to help push that reflex. There's certain medicines that will delay ejaculation, as well as recreational drugs that will delay ejaculation. And you have to understand that, is there a way to supplant that medication that's prescribed by something that's not going to cause it? These are things that you need to look at. And then finally, age. It just gets harder, the older that you get. So especially in our post-implant patients, we make sure that every single implant patient, we evaluate them for a hypogonadism, meaning low T. You have to have testosterone in order to orgasm. You have to have normal levels in order to orgasm. Occasionally, you'll find patients that have very low levels and still able to orgasm, but you got to make sure that that's taken care of first. After that, I use Dr. Goldstein's algorithm he's had for years, which has worked very well for us. You can use some antidepressants, this one specifically, that'll push dopamine, which is going to push that whole reflex to spark. The second drug that we try based on this algorithm is Adderall. Adderall will get you to focus, and if you focus enough, you can actually ejaculate. And then the third thing, which one of my patients was telling me about, is you borrow your partner's pocket rocket, put it right at the penoscrotal junction, and that'll stimulate that arc to kick off. So the good news is, you've gotten this implant, you're able to penetrate, and it's nice to orgasm as well. And in the hands of dedicated men's health experts, they're going to have all of these little tricks in hand. And there's a few that I haven't named that we don't use for other reasons, but I'm sure that you're going to hear a nice variety if you go to the right center. So it's something that can be taken care of, and I understand you're focusing on this, Randy, because we see it all the time. You will be taken care of if you're in the right place. So we'll see you on the next one. Take care.